Hi, everyone. Today we are tackling pain and the health trends that are blowing up right now. People are trying to stop their pain, but do they work?
Well, that is the $1 million question in a $1 million industry. And as a chronic pain expert and as an MD and chronic pain sufferer myself, and as a holistic functional medicine doctor, I'm going to weigh in. I'm actually going to weigh in on tons of these health trends today, 8 in fact, and maybe even more. And we're going to dive right into it. And here we go, everybody. Boom.
Hi, everyone. Thanks for joining us for Transform Table Talk Live. I am Anna Manuel alongside Dr. Maggie Yu, and you said, as a physician, as a pain sufferer, as somebody who has prescribed some of these things and watched thousands of people tackle these, you have a lot of credentials going into today's topic.
I really do, and it's a topic that's near and dear to my heart. First thing first, though, I want to acknowledge Boone 503 it's coming in from Portland. Everybody who's watching, oh my gosh, Agnes Machala jumping in. My PA folks, how many of you are from PA? I would love everybody, alumni, Kristen Norton from Seattle area coming in. All of you guys who are watching right now, tell me where you're watching from. And if you're alumni of any of our Transform programs, type in chat which program you're an alumni in. And if you haven't been in any of our Transform programs, tell me where you're watching from and tell me why you want to watch this. What chronic pain issues are going on for you? Type it in chat. Give me a holler, say hello, because you know what? I don't want to talk at you. Ann and I want to talk with you, and connection and interaction is why I love going live every single week with you guys. I dig this connection.
Yeah, we've got a lot of alumni and recent alumni watching, and then people who are just interested in learning more.
Hi, Kyla. Hello from Ohio. I love it.
Yeah. And tell us specifically, do you deal with pain? If so, what kind of pain are you dealing with? And have you tried anything? What have you tried to try and address your pain? Because we're going to talk about some of the kind of popular trends that are happening right now. And we're going to find out exactly from the source, from Dr. Maggie, whether these things are worth it. And if so, why or why not?
Well, first today, why are we doing this episode and who the heck inspired this episode? I want to give a huge shout out to I am Mark Manson. And in fact, I'm going to actually have a little instruction for all of you guys here, okay? Mr. Mark Manson here, he wrote a book of The Subtle Art of Not Giving a F, you know what, CK, okay? And I love that book. I really do. And he now has a YouTube channel, and it is at I am Mark Manson, and it's called about life advice that doesn't suck. So what I'd like to do is I want to have you guys acknowledge Mark here with typing in chat at I am Mark Manson, you don't suck. And the reason I'm doing that is because he had an episode 3 weeks ago that Ann and I just loved. I
mean, you sent it to me. You were like, I love this. I want to channel this energy. I love everything about him and this topic. And I watched it immediately right after because it was all about life advice, overrated or underrated. And he really
health advice. It was actually self-care trends that are either overrated or underrated. And his co-host basically bounced him these top over or underrated self-care trends. And I thought it was awesome because people really got to see Mark's perspective on this. And he has a lot of experience in a lot of these trends. And I was like, why don't we do this for healthcare trends that are related to pain? So I want to say it's because Mark's episode 3 weeks ago on his Life Advice That Don't Suck podcast on YouTube that we are having this topic today.
Yeah. And so Boone, in fact, says, love that channel as well. Watch that video. It was so good. So if you liked that, you're going to love today's topic as well, because we're going deep all about trends for pain and weighing in much the same way he did. But everybody make sure to go ahead and put that in the chat, just like Emma Info Dumps. I am Mark Manson. You don't suck.
You don't suck, Mark Manson. In fact, you don't suck at all. You rock. You pretty much rock. And I'm actually going to, if you guys want to link to that episode about self-care trends, overrated or underrated, put at I am Mark Manson in chat. Just say episode, and we're going to post that link to that episode so you can watch it because it really inspired this episode.
Yes. Okay. And I'm so excited to talk more about some of these trends, Dr. Maggie, because we have a lot of them to get to.
Yeah. And here's the thing, everybody. I've been a chronic pain sufferer myself I'm 54, and I've been a practicing functional medicine physician for now 27, 28 years. Okay. So I've been at this for a long time. And if you guys know anything about my history, it really started out with my chronic pain with herniating a disc in my low back at the age of 22. Okay. I know I popped a disc at the age of 22. And the question really was why? Why did that happen? So young, right? And it started with neuropathy and sciatic pain going down my left leg. And then once I delivered, I had two children, one at age 30 and one at age 32. After the birth of each of my children, I developed chronic pain syndromes, and that was later diagnosed as fibromyalgia, tendonitis with carpal tunnel syndrome. And later, I got into several motor vehicle accidents, had some ruptured discs in my neck, causing severe neuropathy in my hands, chronic neck pain, jaw pain, right? And shoulder pain. So I've been at this for a really long time, and I've been solving these mysteries for a really long time, not only for myself, but in becoming and learning to become a functional medicine physician. I have tried tons and tons and tons of holistic, alternative, scientific, popular lore theories. I've tried them all. And so I'm ready to share my experience, my advice, and I have witnessed thousands and thousands of clients and patients go through many of these therapies as well. Either I've tried them, I've supervised clients going through them, or I've been a witness to many people going through them. So I'm going to weigh in here big time.
That's great, because we have so many people posting in the comments what pain they are dealing with and what kinds of things they've tried. So you're ready to jump right into it, Dr. Maggie. I will hit you with the first topic.
All right, here we go.
Okay, here we go. Topic number 1. Is it a yay or a nay? And we're going to kind of group two together, and they are cryotherapy or cold plunge. Yay or nay? So first, let's talk about what they are.
Okay. So, and how many of you, if this topic interests you, type in chat. I would love to hear, because we asked actually a lot of people in our alumni group and Facebook group, and these were some of the topics that came out over the past month that they wanted to hear more about. Cryotherapy literally is using frozen, I believe is nitrogen, but it's gas of some sort, and it's frozen air in a container at really minus degrees, hundreds of degrees. And you go into this chamber, basically, your head is exposed, and you get really cryotherapy with frozen gas for a period of time, usually a couple minutes.
Yeah,
okay?
like about 2 minutes max or something like that, right? I've done it before.
Yeah. And it is cold, and I've done it. I actually experienced it, I would say at least at this point, 20 to 30 times.
Okay.
In dealing with my neuropathy, my neck pains, my shoulder pain. And so that's one way of getting super cold, super fast, right? The other way to get super cold, super fast is cold plunge therapy, which is have people gone into ice baths? How many people, and those of you who are in competitive sports, peak performance athletes know this, is an ice bath. Mm-hmm. You can do that by plunging and going into an ice bath soaks. And I would love to know what has your experience, whether it's cryotherapy or whether it's cold plunge, jumping into really cold water, or going into a cold ice bath after exercising or for injury recuperation. What do you guys think? What has your experience been? And people say yay.
Many people are saying yay. I would say about 80% of people are saying yay. 20% of people are giving it a nay.
Okay.
Whether or not they've tried it, I'm not sure, but that's what they're thinking you're going to say maybe.
I'm going to give you guys the science behind this, okay? It is an absolute, my vote is, it's a yay, okay? Cold plunge and cryotherapy absolutely is a yay. Looking at scientific research and my own experience with this. And let's drop the yay, and we're going to talk why it's a yay, okay? And the reason is it's something we called cold shock proteins. Did you know that when you shock your body with cold, there's literally proteins that are created called cold shock proteins? Cold shock proteins, once created by your body, it's really anti-inflammatory. Yep, it really is. And in your cells, in your muscles, in your fascia, works against inflammation.
Look how smart Charlene is. She says she thought it helped with inflammation. So right on, Charlene.
And if you guys want to look it up, it's about cold shock proteins. And so it's really interesting. Over the weekend, I was at a place where they had actually sauna and right next to it an igloo room. So it was like they were trying to do the same thing. And when you actually also look at Finland and some of the Nordic countries, it's not uncommon for sauna. They love sauna to be right next to a whole for cold plunge, right into it. However, when you do extremes from hot to cold like that, there are techniques of how to do that. So if you're not used to jumping into severe cold into a cold plunge, there absolutely is a safe way and a safer way to do it, and an unsafe way where you would cramp up like crazy. So cold plunge, I'm just going to let you guys know there's definitely specific ways with which to do it in a safe way that actually will elicit the cold shock proteins. I am going to tell you that going into an ice bath, cold plunge, otherwise, or going to cryotherapy for me has been extremely therapeutic. So I can tell you that, let's say you have, and you don't even have to do your whole body. So sometimes like when you go to a cryotherapy place, it's everything from your neck down, right? You can do it that way, but they also have localized cryotherapy. You can just cryotherapy let's say you have carpal tunnel, you can do cryotherapy just localized in one area as well. It is extremely effective. And I will tell you, any athlete, anybody in professional sports, collegiate sport, will tell you the benefit of post-workout going into an ice bath, how therapeutic that is. You can literally shorten the amount of time of healing and recuperation that your body needs by going into an ice bath.
And of course, I'm thinking when I'm hearing you talk, this is for most people. Of course, there's going to be some people that maybe it's not the right treatment for. I'm just offhand thinking about somebody with Raynaud's maybe. Would something like this maybe not be the best idea for them?
Oh my God, Anne, you're so freaking smart. I freaking love you. There's no subtle art to loving you. I just love you. Smart. I'm really dealing with a smart audience here. And so here's the thing. If you have an autoimmune condition called Raynaud's, where as a result of cold exposure, it causes your arteries in your hand to constrict, turn blue, and hurt, this is not going to be right for you. Cryo or cold plunge is not going to be right for someone with Raynaud's, number one, right? The other thing is someone mentioned, and someone said this in chat, and I want to know, is it E-Boons? Whoever E-Boons you are smart, and it's almost as if like you've been through my programs. So she's like, I heard that it may not be great for someone with adrenal fatigue, and the answer is correct. That is also true, which is that cold shock therapy can activate cold shock proteins, which is anti-inflammatory. But for people who are in adrenal fatigue, sometimes for some individuals can stimulate a fight or flight response, like a sympathetic response that is like, oh my gosh, I'm in danger. And it sends up cortisol. So that cortisol spike, that screaming of, oh my gosh, I'm in danger, your adrenal glands can take cold plunge and that extreme fast temperature change as too much of a challenge to your adrenals. And it absolutely, for some people in stage 3 adrenal fatigue, can absolutely sometimes have a bad reaction to it where they can feel extremely exhausted afterwards, right? So that's not everybody, that's some people. So it's really one of those situations. It's a yay for the vast majority of people. But if you feel like temperature change for you, you've noticed is something you can't tolerate because of Raynaud's or because you have stage 3 adrenal fatigue, I absolutely agree. Then it is a nay for you. But I'm talking about me right now and my experience with it. And in my experience with it, and then the vast majority of the people, it's an absolute yay.
Yeah. And Kyla sharing her experience with cold plunge, she said sometimes her face will get super red, super hot to the touch, and doing cold plunge gives her immediate relief.
Right. Absolutely. So I've experienced great relief, shoulder pain, neck pain, neuropathy pain for myself. I have neuropathy, and it actually can relieve neuropathy for me up to 3 to 7 days afterwards. And so think about if you were chronically doing, let's say you're doing it once a week, how beneficial that could be. So there's long-term effects of these cold shock proteins when it comes to neuropathy.
Now, Wendy's saying, aha, now I know no more cold plunges for me because I'm dealing with adrenal fatigue. But that then begs the question, Dr. Maggie, once you get yourself out of this adrenal fatigue and once you get to a place where you're no longer experiencing it, then maybe this is something that you can try again.
I'll tell you, Wendy, and this is like one-on-one. So like keep typing your comments in here. I'm going to address this. Like looking at Wendy, she says, no more cold plunge for me with adrenal fatigue. It depends, right? It depends what stage adrenal fatigue you're at, number one. Number two, I also have people who are in stage 3 adrenal fatigue there's a spectrum of stage 3 adrenal fatigue. So some people with stage 3 adrenal fatigue, there may be early stage 3 adrenal fatigue, and they might be like, I do it and I get great benefits. So I'm saying, even if you have stage 3 adrenal fatigue, I think it's actually worth a try to see how your body responds to it. Okay. Just FYI.
Yeah, they can't hurt. I mean, and everybody, even if you have a specific illness, things may affect you differently than they affect somebody else with that same illness.
Absolutely.
So,
And hey, if it's your arm, why can't you try local cryotherapy for your arm?
and they have that. I know a place that I go to, they have the full body cryo, but then they also have those targeted cryo. It's like, I don't know, like an instrument that they're able to use on your body.
You can get localized cryotherapy. Why can't you do localized cold, cryotherapy, or even cold plunge your arm or shoulder? You can, even with stage 3 adrenal fatigue.
Now, Emma brings up a good point about this as well. Most cryotherapy that I've seen has been you go to a location, whereas cold plunge, many people have the home cold plunges that they could do at home. Mm-hmm. But are there cryotherapy at home as well, or is that mainly something you go to a location for?
If you're talking about at home, you're talking about icing. If you're going cryotherapy, these are major machines, and some of them are mobile and travelable, but certainly not something that you can buy an in-home unit for unless you want to spend tens of thousands of dollars.
And the people that do the cold plunge at home, I have heard some of them say they spend more time like cleaning and tending to those.
The energy that people get. I'm telling you, if you have a cold plunge and you do cold plunge and this is one of your regular practices, people swear by it because the level of mental clarity, focus, right? And the higher rate of metabolism that you feel for hours afterwards, and mood is huge for people who do cold plunge. The amount of it's a natural antidepressant. It's invigorating as heck. It makes you feel like the zest of life. And you're just like, wow, it is energetic. It really shifts your body energetically into a higher rate of frequency.
So what you're saying is it's worth it. You can do, if it's something that's beneficial for you, commit to it. If you want to go through the cleaning process and the caretaking process of your cold plunge tub, because it gets a lot of benefits.
Can I give you guys a hot cold tip?
A hot tip for the cold.
So here's a really easy way to apply this to everyday life. So one way to try cold plunge is at the end of your shower, flip it over to the cold and do the cold for 20 seconds. And that's the end of your shower. You just did a quick cold plunge.
I love it. And, I used to always do that because they say that's actually good for your hair too. After you've had a warm shower on your hair, if you zap it with that cold water, then it's going to seal up your ends and things like that. So it's the same. Okay. We're going along the same.
All right. Did you like that about cold plunge? Did you learn something about cold plunge or cryotherapy? If you're interested, cryotherapy is available pretty much in every major city. Look up cryotherapy near me, or even you can look at cold plunge near me. A lot of wellness spas now, in addition to having like hot saunas, for example, they'll also have a cold plunge as well. So that's something that you might want to try. Just try it.
Okay, so we talked all about the chill, being cold. Let's spice some things up and talk about being hot now, Dr. Maggie. What about the infrared sauna? What is it? And then tell us yay or nay.
What is infrared sauna? So infrared, so there are different spectrums of light. Infrared is just another spectrum and frequency of light, just like UV light is from the sun, right? Infrared is just a different spectrum of light. Infrared light, especially close to you, near infrared, can penetrate about a couple millimeters, sometimes a centimeter into skin. It is known to actually increase the metabolism and activity of mitochondria. Mitochondria is the molecule that is in your cells that actually allows you to make energy. So it creates energy. It actually helps with healing. So infrared is known to stimulate mitochondrial activity and even raise metabolism. So we know for a fact scientifically that infrared therapy can actually help with energy, mood, pain. So how many people have actually tried using an infrared device? And people use it on their pets. You can buy infrared devices. There's also infrared saunas. So when you go to a sauna place, not only, the infrared can also generate heat. So there's a lot of saunas now that actually utilizes infrared light to generate heat. So
Mm.
it's a combination of the light with heat therapy, which actually improves the effect of it. So when you actually have heat, like an area is heated, you actually increase the blood circulation around it. So when the infrared light actually hits it, it's even more effective. So this, like, you're actually compounding an effect when you use infrared heat therapy. So you're combining two therapies, heat with infrared light. So you're actually doubling up, synergistically improving it. Hugely, hugely effective. And so for me, that's defines what infrared light therapy is. And so the answer is it's a hell yes.
It's a big, big yay. And we're getting some really interesting comments along with this. Eboon said she actually just had infrared on her brain to
Mhm.
help with migraines. So
Boom.
and we're talking pain. It doesn't almost get more painful than migraines, right? And
Yeah.
Jill wants to know, okay, is this infrared the same as red light therapy? Because they both do produce a red light. So can you talk a little bit about, is that the same or different?
It's kind of different. Like, I would say that when you have something that actually operates in the infrared spectrum, that's where you get the mitochondrial stimulation. Red light, I believe, now I'm not the expert on red light therapy. Okay. But I noticed that when we're talking specifically infrared, where it generates heat and it penetrates the skin, it can do a lot of things. Now, red, blue light, those kind of light of therapy actually has some benefits in helping penetration. So, for example, like, how many people have utilized like the dental whitening and they add red or blue light to it?
Uh,
So when you do actual red light therapy, it can actually help the fluoride penetrate more. So it's not infrared, it's red. And the red of that light, along with the fluoride, just helps with penetration. Blue light therapy has some healing. So we know that blue light spectrum can actually help with healing. So for acne, for example,
Mhm.
doing blue light therapy can actually help anti-inflammatory effects. Specific here, we're talking about infrared. So that particular frequency really stimulating for the mitochondria.
You know, I'm a fan of all of these. I've showed you guys how I've got my my mask that's got red light, blue light, all of the colors. I've got the red light helmet. I've got the red light panels. I'm a believer in it. So yeah, I think it's really good for all aspects of not only decreasing inflammation, but healing your skin on the outside as well. Yeah, they remember my mask. Everybody knows. Oh, Dr. Maggie, she's getting hot talking about infrared.
I know. I was like, I'm seeing it on infrared, and then the sun is hitting over here, and I'm like, now I'm getting hot.
Okay, so this is a big, big yes. And Dr. Maggie, you have a lot of experience with the sauna in particular. In fact, you have one. There's lots of home devices you can get. Now, you can get an actual professional device, but there's like blankets and things like that that people can buy as well.
Yeah, so here's the cool thing. You can, like, people talk about at-home units. Can you get infrared heat sauna units at home? Yeah, people can actually buy a unit and they can have their head sticking out of it and get hot. I have a lot of clients who've utilized that, have great benefit from it. People dealing with rheumatoid arthritis, people dealing with neuropathy can really benefit from having a home unit like that. There are also very inexpensive infrared sauna blankets
Mhm.
that uses infrared energy to create heat. And it's literally a sleeping bag where you wrap yourself around it. And that level of heat in the sleeping bag has been really helpful. And people sweat. Sweating is also a great way as you're getting infrared therapy to detoxify. So, like right now, I'm sweating
You're
right
detoxifying just by talking about it. Who needs the blanket?
So I have personally used the Sunhome. It's a infrared sauna blanket, and you literally zip yourself up in there. I have a towel on bottom and top, and I go in there and sweat. And I have a lot of clients who've used it, and it's been super helpful. We can share a link to the Sunhome infrared sauna blanket, and I think there's $100 off. That's a lot off, and just we can share that in the link if people are interested. But a lot of our clients, including myself, have utilized that particular infrared sauna blanket, and it's been super helpful.
Yeah, yeah, detoxifying. Because that's another way, like when you think of exercise to detoxify,
Oh, yes.
let's talk about it.
Well, but wait a minute. So by the way, there is a exercise chain called Hot Works.
Mm.
and Hotworks, and they're not sponsoring this, and it's just a company that has a franchise where they have infrared sauna units where you do exercise in them. And so I have tried them in the local Portland branch, and I love it. I really enjoy it because here's the thing. Not only do you have the infrared light, not only do you have the infrared heat, but you're doing exercise in it at an elevated temperature. And my gosh, when I do that a couple times a week, is my mood and energy and metabolism raise huge. And I've had a lot of clients go and try Hotworks. And I know that a lot of cities have them. Not every city, not every state has them. I know in Oregon, there was one in Portland, but like California, certain states, there's a lot of them. Highly recommend. And I sometimes will go there, and because you can reserve your room online, I will go there and you can watch the pre-workout that they're doing, like yoga or core. Sometimes I'll go in with bring my melt bundle in, and I'll do my melt movement in there just so I can get the infrared sauna as I'm doing melt.
That sounds nice. And I imagine that that might be something to work your way up to a more vigorous workout in, because it's going to be much more intense for you. I mean, I know me just sitting in the sauna, I feel like my heart rate really goes way, way up if I'm tracking it. So it would be something to work your way up to, and melt might be a really great way to.
And I'm going to also share a link for melt method for me. And we'll talk about that more later, but that's a movement modality for anybody with pain. That is a hell yes. I'm just letting you guys know. Everybody in our program, no matter which program, that deal with pain have found melt method to be incredibly helpful. And so I want to share, we have so many trainings around melt method and why it's so great for pain. There's also a link we're going to share where you can I would order what's called the Melt Super Bundle. And you could get, with the code, I think it's Dr. Maggie 30, get 30 days of Melt on Demand for free, which is what I bring. I bring my phone and I go to Melt on Demand and I play one of the sequences, and I do them at home, but you can also go to a sauna like Hotworks place and just do the workout, the program for Melt right in there. And that's like a way to get the benefits of both.
I love it. And Emma just has a question wondering, are there any diagnoses, symptoms where you should avoid the infrared exercise? For me, Dr. Maggie comes to mind, maybe some, of course, there's going to be exceptions, right?
POTS.
Like what about, okay, so POTS is one of them.
Yeah, POTS and mast cell activation syndrome are two that is where it's a maybe, and it depends. And it also can be a workup to it. So what happens with people with POTS, with this postural orthostatic tachycardia syndrome, with them is that, and I have a lot of symptoms. I've had a lot of POTS symptoms myself, and we work with a ton of POTS and dysautonomia patients. And what it is that there is actually a lot of like blood pressure and heart rate changes, right? So instability of the cardiovascular system. And there are a lot of video trainings that I've done around what the underlying real causes of POTS and how to solve POTS. I can solve POTS for breakfast. Mm-hmm. So I know Alexandra, somebody in the very beginning was talk about POTS. Well, if you are interested in learning more about POTS, I have like an 8-part training series on POTS. Put POTS in chat and we can hook you up with that. But with POTS, there are a lot of people that have cardiovascular instability, which means that whether it's positional change, and sometimes minor things will cause their blood pressure to really drop, and their heart can go really, really fast. Mm-hmm. And so some people will also experience this as vertigo. Some people will get severe tinnitus or tinnitus, which is ringing in the ears as a result of this, relating with POTS or separate on its own. And what happens is when you are in a very hot setting or in an infrared setting, it causes your blood vessels to dilate, right? Which means blood pressure typically will drop. So what I find is people with POTS dysautonomia long haul may not be able to tolerate extreme changes in temperature, whether it's cold or heat, and that they can't tolerate it. So I would say for people with that, it's definitely a maybe or a hold off, maybe later. Like after you've worked with me for a while, couple weeks, and you're already starting to improve, then it may become a maybe.
Yeah. And Alexander must be new to watching some of your videos. So welcome, Alexander, but says, most doctors say POTS is not curable. Is that true? Well, if you are working with Dr. Maggie, she says that is breakfast.
Well, anybody who's worked with me with POTS and dysautonomia and had that turnaround completely or mostly, just type in chat, like, don't believe me, just believe other people who've actually gone through the process. It is absolutely reversible.
Yeah, yeah.
Mhm.
And getting back to people who might not be able to handle infrared, Boone is over here saying hypotension caused her to stop doing CrossFit
Yeah.
and a particular type of yoga. So there certainly are. I saw somebody else say that they're
Hypertension is low blood pressure, which
Mhm.
is in this family of people with
hot,
POTS and dysautonomia, right?
right?
So it's not for everybody, right?
Right. Somebody else said lupus, heat for them makes them really sensitive. I know
Correct.
anybody who has like erythromelalgia, that could potentially be a problem. So of course there's going to be some that
Yeah.
it's not good
And
for.
what people will notice, like with lupus, when there's some, they have a butterfly rash. A lot of autoimmune diseases can have rash that is painful when exposed to sun. We call that photosensitivity, right? So if you know that you have that painful rash when the sun hits your skin, and it doesn't even have to be lupus, it could be a number of autoimmune diagnoses. Getting hot will probably make that rash worse. And the interesting thing is that that temperature change will be irritating or triggering for that. But the reason that heat works for many other inflammation-based illnesses or pain is because of heat shock proteins.
There you go.
So this is the thing is, so there's a benefit to heat shock proteins being very anti-inflammatory, which is why I love heat just as much as I love cold. But there are going to be people with autoimmune issues where that's going to be too much.
Yeah.
And people with Graves, or they're having a lot of hormonal dysregulation. Because how many of you guys have hot flashes? How many of you, will experience hot flashes, night sweats? Sometimes being in that hot environment is just not going to be tolerable for you. So you better listen to your body, because your body's giving you data. So it's not a yay for everybody.
Right. But it's a
Right.
majority yay. And just getting back to Alexander's question that you said, let's hear from some of our alumni. Is POTS something that can go away? Just got to highlight a couple comments here. Emma says, alumni with POTS haven't had a POTS flare since last November. Rarely have POTS symptoms anymore. Stacy says, me too.
Mhm.
And Yvonne says, POTS is much better after Transform program.
Yeah.
So the questions there have been answered pretty clearly.
And yep, I love this.
It can go away.
And Eboon said my night sweats are under control right now. Thank goodness. Yeah. And a lot of those night sweats is because it's hormonal Eboons. Just FYI.
Got it. Okay, so we have gotten through basically 2 topics.
Wow. Okay, we may not be able to get through all 8. Let's get.
I know. Okay, so the next one, and some of these we might be able to go a little bit faster on, but let me ask you now about another health trend for pain. How about the carnivore diet? Yay or nay? What's the carnivore diet? If you haven't heard of it, it sounds like you're eating a lot of meat.
Okay, how many people have tried the carnivore diet? And I love to see what your response has been to it. Because interestingly, for a lot of people, they go on the carnivore diet for autoimmune reasons. A lot of people go on it for pain, and for them, it works. It works to decrease pain. It works. So interestingly, if it works, should it be a yay? And I would say that for some people, it's a yay. On a long-term basis, I have to say it's a nay. I'm going to explain why it works, right? But why, as a long-term solution, it's a nay. Okay. And the reason that it works is that a carnivore diet is actually a pretty extreme elimination diet, where you actually eliminate 95% of other food on the planet. And so in the short run, if there's anything in that other 95% on the planet that you have a food sensitivity to, you actually eliminated it. So it's an extreme elimination diet. So for a lot of people, it can be decrease of their pain. So example, if you're on a carnivore diet, you're not going to get any gluten.
Okay.
Right. So it would absolutely help decrease your pain if you're one of the individuals that gluten sensitive, right?
It really has nothing to do with the extreme intake of meat.
Correct. It's only because you've actually eliminated some of the food items that you might have had a food sensitivity to. But the problem is that, and the other reason that the carnivore diet works is it is extremely high in fat and protein and low or no in carbohydrate. And so we know for a fact that a lot of people, really high carbohydrate, high sugar in the diet is very inflammatory and causes pain. So at the same time, you've eliminated all these carbohydrates, which means that the high fat, high protein, this is also why ketogenic diets can be very effective for carb sensitive individuals. So we know that, these high fat diets can be very helpful for kids with epilepsy. We know that the carnivore diet for a lot of people can help with pain. And that's because you've eliminated a bunch of carbohydrates and sugars, simple sugars. However, why could it be bad? Is because you also are missing 95% of the phytonutrients and vitamins and antioxidants that's in all these fruits, vegetables of all different colors. And your body needs them in the long run.
Yeah. And we're hearing from people who are saying, hey, I think it can do some good. It's worked well for my son. And so that makes sense. It tracks with what you're saying in that there are some benefits to it. There are some reasons, but it sounds like balancing it out with fruits and vegetables would be even better.
Well, you're missing out on so much antioxidants, right? Phytonutrients. You're missing out. I mean, there's anti-cancer in blueberries, they're on the reds. There's so much cardiovascular benefit. That's really great for heart, right? There's so much in herbs and vegetables that are here to heal our bodies that you're missing out on, right? So, and the other part of this too is meat isn't necessarily right for everybody. How many people have actually done food mapping masterclass with us and found out that lamb was a problem, or pork was a problem, or beef was a problem, right? So what if one of the meats in the carnivore diet is actually one of your food sensitivities? There are individuals who go on the carnivore diet and get worse as a result of it. And there's more, but wait, there's more.
Right.
How many people, whenever they eat meat, feels like they get bloated and can't digest it, and that it sits in their stomach like a rock?
What Darlene is just saying right here. Doesn't the meat sometimes stay in your system longer? It upsets our digestion.
I love you. I love you. We have such a smart audience here. So meat is very actually hard to digest for people who have stomach acid problems, pancreatic digestive enzyme problems, and for people who have gallbladder and fat digestion problems. So if, boom, you just say, I'm going to go on the carnivore diet, but you have a digestion problem, you actually are causing a major digestive disruption in your body and can actually make some symptoms worse.
Makes sense. And then, they're saying, well, they know what they need to get then.
Digested. Yeah. So that's the thing is that's why I say that in the long run, being on a carnivore diet is going to be a nay for me. I'm going to say nay on that one.
Okay. That's
all right.
All right. Let's move on then to our next health trend. And this is something that a lot of people have questions about as it relates. What did you say?
Oh, yes.
Okay. Oh, yeah. Here we go. So the next one is CBD. Is it a yay or a nay?
It is a.
Let's talk about what it is. I mean, I think most people know about CBD, but you're giving it to us right away. It's a yay.
It is a yay. And I'm going to talk about it because there is so much research around CBD. CBD is cannabinoids. And in mammals, in animals, and invertebrates, the endocannabinoid system is rich communication throughout our bodies. We have squid across, that have rich networks of what we call the endocannabinoid system. And the endocannabinoid system actually has major immune benefits, pain benefits, metabolism. There's a lot of benefits to actually understanding there's a whole network of this. Just like, there's fascia, there's all these different systems in us. And so what we find is that cannabinoids, we're talking about CBD, right? Actually, when activated for individuals can be very anti-pain. However, the way that it works isn't how we think it works, meaning that it isn't. I'm not necessarily talking about when you're talking about like the plant that has different kind of cannabinoids, there is different phytocannabinoids, different types in plants. And then there's also THC that is in there. Let's say we even take THC out of it and we're just talking straight about cannabinoids. Are they anti-inflammatory? Can they be beneficial pain? The answer is yes. But it doesn't work immediately. So when you're looking at the data and you're looking at the studies, people have to take things like cannabinoids for like 1 to 2 months before they actually even experience it. So if you're thinking that I'm in pain right now, I'm going to take and it's going to work like an Advil, it's not going to work like that.
Oh, and see, that's interesting because we are hearing from some people saying, it didn't work for me. And we don't know Gail's full experience. Maybe she did try it for a
Well,
long
and,
time. But
and it doesn't mean it works for everybody.
okay.
The thing is, nothing works for everybody.
Mm-hmm.
Okay, that's the thing is, so if something is even effective for 30% of individuals in a study, it is a yay. That's
Right.
a really positive response. Just so you guys know, most drugs on the market that are being sold today have about a benefit of about 30%. And that's called effective treatment. So
Okay.
that means for 60 to 70% of the individuals, it didn't work. But the reason why I think that a lot of people say nay and a lot of people say yay for CBD is that number one is they haven't taken it long enough, right? Or they don't understand and they think it's smoking weed. And it's not. CBD, when you're talking, and I'll even share a link. There's a link of a couple products from a company that I trust, and I've used their products as well and recommended it. Designs for Health has a collection of cannabinoid containing products. And I think I don't have a screen share for it, but one of the products, I think it's called cannabinoid PEA, which is the one I use. And I take that on a daily basis. And if I don't take it on a daily basis, it doesn't work.
Mm-hmm.
So for me, like that product contains the cannabinoids additional to a natural compound called PEA, which has been shown to be really beneficial, especially neuropathy. So that Cannaba PEA product that I use with it has been really helpful for my neuropathy. So, and some people, Jan's saying, I use it for sleep. Do cannabinoids help with sleep? Yes, for some individuals. Just like for some individuals, melatonin is really, really helpful. But in another individual, melatonin may not be useful because maybe they don't have a deficiency in melatonin. For another individual, the endocannabinoid system can be extremely active and helpful, while for another, it isn't.
Mm-hmm.
And the other aspect is this. The endocannabinoid system isn't just for pain. It's helpful for sleep, mood,
Anxiety. Look at you saying anxiety. It was really helpful for that due to chronic pain.
Seizures in kids. Okay, I'm letting you guys know, like proven studies have shown that specific strains can be really helpful for kids with seizure disorder, right? So this is scientific data. Fact, this is not about smoking weed.
And they want to know CBD topical because Darlene says she used it on achy muscles and it worked. Is this the same? She wants to know.
Absolutely. So there's a lot of topical products that contain CBD in it. And depending on whether you get over-the-counter products and certain states where it's legal, there's also dispensary products where it's a higher strength. Like it's a balm for localized shoulder pain, hand pain. Like I have a lot of patients with rheumatoid arthritis and pain in their hands. Getting a CBD balm and trying different strengths of it can be extremely helpful for pain. And we're not talking like this is really therapeutic use of CBD products, not THC products, and rubbing it into the hand for pain can be super helpful.
Okay, very good.
And that's not, and here's the interesting fact. If you actually combine a CBD product, some products of CBD combine THC in it as well, there's actually a synergistic effect, meaning it makes the cannabinoid be more effective. So some of the products, even some of the topical products, may contain a combination, and it can actually be helpful when it's used together. But for the sake of discussion here, I'm only talking about CBD alone.
Okay. Now, this next one that I want to talk to you about is less of a trend, and it's more of a we get recommended this so often. So you go to the doctor or you speak to your physician and you say, I've got this pain or that pain. And they say, well, why don't you start by taking some Tylenol? That will get rid of your pain. And curious to hear from you, Dr. Maggie, is Tylenol a yay or a nay when it comes to pain?
It is a hell no. I really it is an absolute nay. There should be a red box label on Tylenol. Absolutely not. It's actually crazy to me that we actually give our children, pediatricians, pre-medicate kids with vaccines with Tylenol. Tylenol is known as a hepatotoxin. Like it literally is toxic to the liver. It is, and it is one of the drugs that taken in not even that much can cause liver failure.
Wow.
Yeah. Think about this.
And yet that is what we're told to give, whenever you have a fever, whenever your child's experiencing something.
Yeah, there's
no when I was pregnant, I remember they said, just take some Tylenol.
So the other thing I'm going to let you guys know, unrelated a bit, is when people have talked about childhood vaccines, what they have actually found was adverse reactions to vaccines before Tylenol was presented versus when they started to pre-medicate kids with Tylenol before they got vaccines, the number of adverse reactions to vaccines went up quite a bit.
Wow.
So the way that Tylenol really occupies the liver really inhibits the liver's ability to break down other toxins. So you get buildup of a lot of other things, causing increased reactions to other things that require the liver to break down. So it's a hell no. And so the other name for Tylenol is acetaminophen. So a lot of over-the-counter cold remedies, looking at NyQuil, for example, has acetaminophen in there. So if you're thinking about taking an over-the-counter medication for pain, for cold and flu, make sure it does not contain Tylenol or acetaminophen. And so I'm sure somebody's going to ask, what can I take over the counter then?
That's the question. It's then, okay, so what are our options here? Because what can you do?
Yeah, I would say that of the two evils, I would say that sometimes it is okay to take Advil, which is ibuprofen, which I believe, it is absolutely better to take. It's a better option as an anti-inflammatory, but there's a downside to it, which is it's really hard on your stomach and can cause ulcers, right? But at the same time, if you take an over-the-counter dose, like 200 or 400 milligrams, 1 or 2 tablets, and you take it with some food and you take it once in a while, it is for me a maybe. And sometimes you just have a cold and flu and you need something for the body aches, and that, it's a maybe, right?
Well, it's not as damaging to the liver as acetaminophen.
Right. For me, they're absolute best options. The best options, believe it or not, are going to be high dose omega-3s. So when you look at our pain protocol, I don't know how many of you guys have our pain protocol. I have a list of Dr. Maggie approved supplementation for pain. And I will tell you, high dose omega-3, our Pro Omega 1000, great for migraines and headaches, great for pain in high doses. And then the other thing is there's 2 products that are awesome. ProMove. ProMove has boswellia, ginger, that has proteolytic enzymes in it. ProMove is amazing for someone in acute pain. And so when you look at the ProMove on the pain protocol, I have directions on how to use it. And I'm even going to give you a hot tip on ProMove. You can take up to 8 a day. And holy heck, is it helpful.
So I'm hearing if you can take up to 8 a day, this must not be something that is in any way damaging, like acetaminophen and ibuprofen.
No.
Yes.
No, it actually works with your liver. It actually works with your body to be anti-inflammatory. It actually doesn't cause a stomach ulcer, right? So we're talking plant medicine at its best combined. So that's safest and effective. So I love ProMove in combination with SPMs. SPMs is actually a form of the end product in fish oil breakdown, omega-3 breakdown. SPM, the molecule, is one of the most powerful Pac-Man at the local tissue to eat up inflammation. So it just takes 2, like our SPM Max, 2 of those with ProMove, and you got the strongest anti-inflammatory, anti-pain. So it is stuff I talk about in our pain protocol, and I don't want to over-focus on that, but this is about nay on the Tylenol and maybe on Advil, and a hell yes when it comes to pain protocol using the power of herbs and plants with omega-3s. Those are hell yes.
And if you want the pain protocol in the chat, go ahead and type pain, and the team here is putting a free link to the pain protocol in there for you to have complete access to. That's very helpful, Dr. Maggie. I appreciate it.
Wow, okay. I can't believe time is flying by here, but we have a hot button issue here.
Okay, let's go to the next one then. And you've done a lot of research yourself about this. I want to hear about, is microdosing helpful for pain?
What is microdosing? How many people know what microdosing is? How many people want to hear about microdosing? It's not a topic I've touched on yet, but it is a hot topic. And right, how many people? I mean, Yvonne says, I love SPM and ProMove. That combo is killer, right? It's amazing. Microdosing, as I'm talking about it, how many people want to know about it? How many people have heard about it, read about it, and is interested about it? Is where you take micro doses of psychedelics, like psilocybin, and other psychedelics at low dosing where it's not psychedelic.
And what is it, like a liquid? I know nothing. Is it a liquid? Is it a tablet? Is it a pill?
Can't be either, but it's really micro doses, right? And yeah, Lachey said, let's talk about microdosing. Really should. It is plant medicine, right? We're looking at plant medicine like ayahuasca, psilocybin, at super micro doses. And what you find is interesting is that there's high doses of plant medicines for certain purposes. Can low doses, microdosing it, actually have a change in what we call neuroplasticity. That is a hot button term. What do you guys know about what neuroplasticity is? Can nerves go back to a state where they're really elastic, meaning like open to change, rewiring, regrow? Can nerves regrow? Can your brain can your brain have increased neuroplasticity where you're more agile, more able to learn new things and be more open and wide for changes in nerve brain patterns or local nerve patterns, right? And the answer is there are so many studies to actually shows that the psychedelic medications, the psychedelic herbs, can be macrodosed, right? But now microdosing is showing that there is changes in neuroplasticity for things like pain, right? And for mental acuity, open for brain focusing, for peak performance, microdosing. There are now study after study coming out. And interestingly, microdosing now in combination with other herbs is really protocols are coming out. So, for example, if you take low dose psilocybin, one of the protocols actually talks about what if you added niacin? Niacin causes blood vessels to dilate. What if you added lion's mane? Lion's mane is a mushroom extract that causes blood vessels to constrict. So now if you microdose and you combine it with a protocol where you use niacin to expand blood vessels, lion's mane to contract blood vessels, and you microdose that in a specific protocol working with a medical professional, can that improve neuropathy and pain? And can it improve athletic performance?
Oh.
Can it improve actual brain focus, recovery, brain recovery? What about Parkinson's? What about people with MS?
Oh, wow. And I think you touched on it, but people are asking, so like, again, at these low doses, we're not having hallucinations. These are micro doses that are just causing these other things that you're mentioning to get better.
Yeah. Yeah. And I'm going to let you guys know that I have witnessed incredible changes with people with microdosing protocols, working with professionals, and in all sorts of healing. And I'm not just talking about pain, but people healing from trauma. So in the realm of psychedelics, just so you guys know, there is so much research. And now many countries and even certain states, look up MDMA and trauma. Right, using MDMA for PTSD is incredible. And I've witnessed people who have really recovered from lifelong of trauma, things that 20, 30 years of therapy couldn't do, that in a couple sessions of MDMA working with a therapist, a psychedelic therapist, be able to literally, it's done. The healing is done.
That's incredible.
The healing is done. Right. And if you guys even go on YouTube and look up, there was a documentary of in Australia recently legalized MDMA for complex PTSD. And there was a case with a man who had lifelong trauma from a childhood trauma. And I believe in that documentary, from my recollection, one session with MDMA working with a licensed therapist with that, gone.
Wow. One is all it could take. And so People have questions then about this. Like, what kind of doctor exactly do you work with? Is this something that's legal in the United States, for example? How do you go about doing this?
Yeah, I don't want to actually go into that right now. And it's beyond the scope of this. It's such a big, deep topic. And there's a lot of people that have a lot of feelings about it. And I just don't want to get into the politics around this. So I wanted to just say that, wanted to share the science, wanted to share with you my experience and my research, my experience in watching people go through this. It's been honestly mind blowing, mind blowing.
That's wild.
Yeah.
It's an option. It's a healthcare trend on the table that you have seen work. So
I know it works. I know it works.
in terms of yay or nay, or maybe what you're going to say is
It's a maybe.
it's a maybe.
It's a maybe. And the science and the research is out there. And I've witnessed too many cases to count where it's been life-changing and it's been a game changer for people. So, but again, there's a lot of problems with access. There really is a lot of problems with access, and there's a lack of training, and there's a lack of providers that are able to help support this.
Got it. Very helpful. Thank you for dipping our toes into the world of microdosing.
Yeah, so we're going to get controversial here, right? So we're at 54 minutes and we had so much. I'm wondering if you guys think, I mean, I want to know, like, if you guys got what you guys got out of this. I mean, has this sparked your interest? Top healthcare trends for pain. Was this cool? Was this great? I would love to hear some feedback on you. I mean, we just talked about microdosing, and is this something that you've heard about? Is this something that bugs the crap out of you that I'm even talking about it? Or is this something that was great, really fascinating, and opened your eyes about something, right? So, I mean, we already went an hour and we had 4 or 5 other trends. And
we have other things we were going to talk about. I know. And Emma said she loved this format. It was so fun. She learned a lot. So Dr. Maggie, I'm wondering, maybe we can continue this. We've got more to talk about either on another day with pain and with other topics as well, because I think that this was very successful.
Yeah. So here's the thing, everybody. I am a chronic pain expert. I love to, and I have explored every avenue, and I know so much about how to end pain for people that it is something that we deal with in all our programs. Whether, you're thinking about food, having a reaction to food causing being a source of your pain, my food mapping masterclass, huge. We just had someone share a win from my food mapping masterclass where her RA pain is gone. This is just 6 weeks, right? I call my food mapping masterclass a 6-week one and done. And pain, rheumatoid arthritis, pain con. So food and pain was something we explored recently on a workshop that I just did. So I don't know how many of you guys were part of the pain workshop, but if you want to see a replay of the pain workshop, type pain workshop in chat. We could share the link with you in chat. I shared the pain protocol. Now, the other piece of this is hormones is big with pain. There's a huge link between hormones and pain. And if you know that, pain became huge when your hormones change, postpartum or perimenopause, my hormone masterclass, that's where I end a ton of pain working with people on their hormones. So if you're interested in learning more about my hormone masterclass, there's a link. And most importantly, like, book a chat with our team, because our main Transform program is whether the pain is from IBS, autoimmune disease, POTS, dysautonomia, whether it's from any chronic pain syndrome, neuropathy, right? I love to deal with chronic pain that are complex, that nobody else can help with. There's our main Transform program where, you know what? I eat those pain syndromes for breakfast, literally. I love to do that.
Well, that's true. I mean, I can't tell you how many people I've talked to that have graduated your program or have worked with you directly.
Yeah.
Tell me in weeks, the pain that they've been experiencing for years, and sometimes cases decades, has diminished, has gone away, has gone from a 10 to a 2. It sounds like the stuff of magic, but it's not. There are specific reasons by you attacking the root causes to these problems that you're able to address it.
Absolutely. So, and I can't help you unless we talk to you. So we have opened up a bunch of spots to talk to you guys on the phone. So we're going to put the link in our chat. So over the next 2 days, we doubled our spots on the phone. Just so if you want to end your pain and you want to learn from and talk to open-minded experts like myself, to end your pain, I would book a chat with our team. I want to learn more about what's going on with you so we can solve your health mystery, because it's not a mystery.
Not a mystery at all. Dr. Maggie, going forward, people are asking for more of this. So maybe that's something that you'll consider.
Well, would you guys like a part 2? Because we have 6 other trends we didn't even get to. If you want to, if you like this, you can thank I am Mark Manson for this format, where basically we pick a topic, whether it's pain, whether it's food, or whatever the topic is, and we really take these healthcare trends, and I go through and I sort it out, and I tell you what is science backed and what my expert opinion is on those hot topics. If you love this healthcare trends format that we have, put more healthcare trends, and you can also write thanks at I am Mark Manson.
Yeah.
And I will do this again.
We're getting dozens and dozens of comments coming in, mostly people just saying, yes, yes, please, part 2. Yes.
Love it. All right, everybody. Can you give me a boom in chat? And here's the other thing. We are no longer able to go into Facebook live with this, into our Facebook group. So what I would love is, I'm going to share a link right now to this live on YouTube. And I have one piece of homework. The best way that you can say thank you and you want me to do this again is click the link right now. And or if you're already watching on YouTube, click subscribe right now to the YouTube channel, ring the bell, and then type in chat, boom. That means you did it. And if you're already a subscriber, put boom in chat. I love you. Thank you so much. Do it for me. That will bring joy to me. And I promise you, I'm going to have a part 2. Is that cool, everybody?
Yay, she's going to do a part 2. Dr. Maggie, thank you for spending your time on this topic and for all of the enlightening information. As you can tell, pain is a big, big issue for people. So any way to tackle it that isn't just your standard advice is so helpful. So thank you for your time today. And we look forward to part 2.
All right, everybody. That is a wrap. And I'm going to sign out. Have a wonderful week, and I'll see you soon. Bye, everybody.